You're listening to Health Coach Conversations, a podcast where our conversations help health coaches all around the world to level up our businesses and to get more clients.
Hello and welcome. This is Kathy Sikora, founder of the Health Coach Group, and today I am interviewing Dahlia. Dahlia is the founder and CEO of Panacea and has a BS in biology and chemistry from the University of Miami. Dahlia's experience working for genetic laboratories exposed her to the reality that very few patients were able to access valuable preventative clinical genetic tests. With an additional 6 years in healthcare IT, Dahlia learned about the technology solutions integral in pushing healthcare into a much-needed era of modernization. After embarking on a multi-year journey to unravel the reasons for genetic testing underutilization, she met Dr. Hinko Gearman, and they were inspired to create a solution. Panacea was founded with a mission to improve access to clinical genetic testing so that people can get in control of their health and prevent disease. Panacea now offers residents of almost every state the ability to access at-home clinical genetic testing called whole exome sequencing, empowering people to potentially save their own lives. So let's start off with defining, before we start talking about everything else, what whole exome and genome sequencing is.
Yes, that's really a fantastic place to start. So when we talk about medical genetic testing that essentially identifies where your inherited risks are, in medicine, one of the most comprehensive genetic tests, or two of the most comprehensive tests, are whole exome sequencing and whole genome sequencing. Now, they're very similar, but there are a few caveats. So when we talk about whole genome sequencing, we talk about a test that essentially reviews every tiny little bit of genetic information that is inherited from mom and dad. Now, people sometimes ask me, so, what does that mean? What is the genetic information? How do we kind of define that? So we have genes in our DNA, and then these genes essentially carry information, right? They give our bodies instruction on what to do, right? There are sections of DNA outside of the genes. And as far as we know, they're not necessarily coding or instructing the body to do something. They're very likely doing something. We just aren't 100% sure what they're doing. But those regions outside of the genes are still genetic information, but they're not contained in these information packets called genes. Now, genome sequencing, whole genome sequencing sequences the genes, the area, the little nice little purses of information, and those areas outside of the genes that kind of just don't tell the body what to do, right? Or at least we're not 100% sure what they're telling the body. Now, whole exome sequencing is a little bit more specific. It's still a very comprehensive review of your genetic material, except it only focuses on those packets of information called genes. It doesn't necessarily take a look at the DNA that sits outside of the genes. And the reason why that's still pretty significant information is because, as far as science understands today, most of the genetic changes that impact disease are actually occurring in those gene packets. There's very, very little genetic changes that happen outside of the genes that impact our health, as far as we know today. And so if you're going to have a very comprehensive look at your genome, and you want to kind of get the biggest bang out of your buck as far as like cost effectiveness goes, and also comprehensiveness of information, you might actually want to do a whole exome test, not necessarily a whole genome test. The prices of each are still pretty significantly different. Whole genome sequencing is still a lot more expensive than whole exome sequencing. And it doesn't really deliver information that we know what to do with, right? Because it's looking at the genes plus the areas that we really don't know what to do with. And so that's why I think our conversation when it comes to what we do at Panacea, we focus more on whole exome sequencing. It's just the best, the most juice for the squeeze, essentially.
Okay, so since we talked the first time, I talked to my daughter and she has had whole exome sequencing done.
Wonderful. Okay.
Tell me the cost difference between, we got to that at the end before, but one is more reasonable than the other. And if somebody was supposedly going to refer a customer to you, how much would it cost for the exome and how much for the genome? And I know I'm asking about money early on, but
That's fine. No, I think it's an important question because I think it kind of, puts this into perspective, right? So a few months ago, there was a document that gets delivered to my desk essentially every year. And it is a comprehensive review of the average cost of a variety of different types of genetic tests that are available in the United States market. And it not only shows you the different types of tests, it shows you the specific cost, like the average cost of this type of testing. Last year, whole exome sequencing on average in healthcare in the US was about $10,000. It was about $9,800, right? Whole genome sequencing in some cases could be double that.
really,
Yes. Now, again, this is the average cost, right? Not every lab is going to bill your insurance company, $10,000. They could bill 5,000. They could bill 15,000. Right? It's an average measurement. But you're talking about testing that is in the thousands, right? Not all the time is it covered by insurance. It's certainly not going to be covered by insurance for preventative purposes, right? There has to be a real significant reason why this patient needs a test, right? And it is very unlikely that your doctor is even going to order it for you, even if you are high risk or sick, because there are smaller, less expensive tests that review just a couple genes here and there that they might prefer to order for cost purposes, for insurance coverage purposes, right? We believe that this is actually a waste of time and a waste of money for people. So what we do at Panacea is we partner directly with laboratories, clinical, CAP, CLIA certified laboratories. We partner directly with genetic counselors, and we partner directly with physicians who are trained on how to utilize genetics and how to order genetic testing for people. And through those partnerships, we negotiate pricing substantially so that we can essentially deliver a comprehensive, potentially life-saving test to the public without having to deal with insurance coverage, without having to go and beg your doctor for it, for literally $1,000. And in some cases, it's even less than that for whole exome sequencing with some discounts. So you're talking about pretty much a 90% discount compared to what the average whole exome test costs in American healthcare today versus what you can get it direct to consumer through a company like Panacea because of our partnerships. It is uncommon to see a clinical whole exome test being offered for $1,000, especially when it comes with genetic counseling, which is a few $100s in and of itself, and the physician oversight, which again, as a consultative visit could be a couple $100s in and of itself. So the pricing, when you're talking about pricing, especially with Panacea, you're talking about insanely discounted pricing because of the special partnerships and relationships we've been able to build with clinical laboratories and doctors and genetic counselors.
right.
I hope that answers your question.
That does.
Wonderful. We don't currently offer whole genome sequencing right now because we sincerely feel like whole exome sequencing is really the best way to go, especially for the patients and the people who want to have a comprehensive test for an affordable rate. But it is something that our labs can certainly do, and we can certainly offer it in the future. But it likely will be a little bit more expensive than whole exome sequencing because that's just the way it works.
So one more question about that. If you got whole genome sequencing, would that cover everything that would have been covered in the whole exome too, or would you need?
It would. So whole genome would cover everything that's in the exome plus a little bit more, which again is those spaces outside of the genes, right? The problem is genetic testing is only as useful as our scientific knowledge of genetics in general, right? And so what's going to likely happen is you're going to get a lot more data that scientists don't know what to do with, or the doctors don't know what to do with. And so it's kind of a waste of money at this point, because it is going to give you more data, but the data might not be interpretable, right? Because again, we're not 100% sure what's happening in those areas outside the genes. And even in some cases, we still don't understand what's happening inside the genes, right? We don't understand what every single gene is doing. And so it likely at this point is going to be more data for more money without any real, utility, because it's not very clear what those areas outside the genes are doing. And again, that's why it makes whole exome sequencing more useful.
What is the difference between clinical genetic testing and testing with companies like 23andMe?
Yeah, so there's two really big important things to understand about the differences. Number one, most direct to consumer companies, most of the genetic tests that we hear about advertised directly to us on social media or what have you, are going to essentially deliver information that is likely not healthcare related, right? They might offer something like ancestry. They might offer some, fun tidbits of information, like if you have a genetic aversion to cilantro, or, if you have hitchhiker's thumb, or something fun like that, right? And they might even advertise some health offerings. They might look at very few genes or very small areas in very few genes and relay that information back to you. The problem is they're likely using a very different type of technology than most medical genetic testing uses. They're using microarray, and microarray is kind of like a search and find. Basically, the technology is looking for something very specific in your genome, and if it doesn't find it, then it's essentially a negative. The problem with that is you don't always know what you're looking for in medicine, and so you are going to miss a ton of information with microarray. And microarray is fast and it's cheap and it kind of gives you, some fun detail, but it is certainly not ideal when you want a comprehensive, deep review of information that you might make health decisions based on, right? When it comes to medical genetic testing, clinical genetic testing, normally the technology that's used is called next-gen sequencing. Next-gen sequencing is a literal reading of every single letter of your genetic alphabet. So it's almost like me giving you a document, Kathy, and saying, hey, Kathy, read me this document, but don't read me the words. Read me every single letter of every single word in every single sentence of every single paragraph. So it misses nothing. This is not a search and find. This is a detailed, like obsessively detailed review of every single piece of your genome, right? Of your genetics. So again, it's very thorough, and it in theory doesn't miss any detail. And because of that, it reveals information that could be very useful for you medically. You can make healthcare decisions based on this information reliably because, again, it reviewed your genes deeply and widely. There are companies today that are popping up left and right that are advertising whole exome and whole genome direct to consumer. And they might be offering it for a few $100s or even a couple $100s. The problem is, although they might be using next gen sequencing and they might be reviewing your genome comprehensively, they're not doing this at a clinical laboratory. In the US, a clinical laboratory typically has two certifications, a CAP and a second one called a CLIA certification. These are certifications that essentially keep the quality and the standards of the laboratories very high. I think one of them is a federal designation, actually. And what that does, it allows physicians and hospitals to reliably utilize these labs, knowing that their standards are very high, their quality is high, and the information that they place in the patient's reports are very reliable. That is not the case with a direct-to-consumer lab. Anybody can go buy a genetic sequencing machine for a couple $1,000,000 and run tests and sell them to the public, right? But it doesn't make them clinical standard tests. And so it's very important for someone to understand when they're buying a test direct to consumer, if that is a test that is run through a CLIA CAP certified lab, are there genetic counselors that come with the offering that can interpret this information reliably? And are there technicians and geneticists at the laboratory that are reading this information that comes off the machines and, applying real scientific data to these results so that you as a user can receive a real quality, reliable clinical test? This is one of the biggest problems in genetic testing today is people don't understand there are vast differences between the quality and reliability of genetic tests. And unless you're getting a clinical test that is run through a CAP and CLIA certified lab, I would certainly not base any health decisions on those tests.
Yeah, without a person that knew how to interpret it, you could really, I mean, it's like reading things on the internet. You could really have
Absolutely.
problems.
Absolutely. That's a very, very valid, strong point. The information, the raw data that comes off of these machines is very complex. And unless you have the scientific knowledge, unless you are a geneticist or an expert laboratory technician that can understand how to translate what this genetic data means for this particular individual and use the latest scientific data and scientific discoveries to understand what these particular changes in this individual's genome might be, you're really not receiving reliable information. And so these labs have to be high standard laboratories. They have to be clinical laboratories. This is not fun stuff. This is not, what percent Italian you are, or, like I said, if you have a hitchhiker's thumb, right? Like I mentioned before, this is information about your disease risk and what healthcare decisions you could essentially make based on this particular risk, right? So it's super, super important that these genetic tests are coming from dependable, reliable, high quality labs. And that's exactly why we only work with CAP and CLIA certified labs.
Okay, we talked earlier about, whether people would be covered or their doctor would send them for that kind of testing or not. What reasons would they have for sending them for testing?
What reasons would a doctor have for sending an individual for testing? Yeah. So one thing I want to say, preface this with, is that unfortunately, doctors are typically not following the guidelines that exist in genetic testing today. To no fault of their own, really. Doctors, I'm making a generalization here. There are some doctors that are very skilled and very trained and do order this type of test often. But in general, your average primary care physician is not ordering you a preventative comprehensive genetic test. It's just not something they do. They really lack the training on it. And they also understand that insurance companies are going to give the patient a hell of a time because they don't widely cover this type of testing for somebody who just wants it for preventative purposes. So that's one point. But let's pretend that all doctors everywhere are following the guidelines. They're very well trained. They know exactly when to order this type of testing. The guidelines stipulate that if you have a heavy family history of disease, for example, you have multiple related cancers in your background. Your mom had breast cancer, your aunt had ovarian cancer, and maybe your grandmother on that side had breast cancer as well. That's a red flag, right? So a doctor might take that information and say, this might run in your family. Let's get you tested. Let's do a genetic test for you. They're certainly, again, not going to order a comprehensive genetic test. They're not going to order whole genome or whole exome. They're going to order a small panel that looks at a handful of genes. And they will hope that your insurance company, because you fit in the guideline, is going to cover it for you. But that's not always the case. The thing that is even more frustrating is studies are showing that even if doctors were following the guidelines super strictly, the guidelines as they stand today are missing about 50% of people who do have genetic mutations and could develop a disease based on those particular genetic mutations. So even if our healthcare system was working flawlessly and every doctor was following the guidelines themselves are missing about 50% of people who should be getting tested. So, and we know that doctors are not following the guidelines and that 80% of people who should be getting tested are not getting tested. So that's why Panacea exists, because the barriers and the problems that exist in healthcare as it stands today are so vast, and they're preventing the vast majority of people whose lives could be changed or saved by this type of testing from getting testing. I hope that answers your question. I know I added a lot more information in there.
It does. So, okay, so most of our listeners, we've got a lot of doctors, we have a lot of nurses, we have a lot of dietitians, we have health coaches. So, can anybody request the testing, or do you need to have some kind of licensing to request it?
That's a fantastic question. The answer is through Panacea, any user can request a test and order a test. The reason for that is because we partner with physicians who review and approve this type of test. And if there's any questions that the physicians have, they obviously will reach out to the patient and discuss the patient's eligibility for this type of testing. This test, by law, because it is a clinical medical test, has to be ordered by a physician. You can't walk up to a laboratory tomorrow and say, hey, I want a genetic test. That's not going to happen. You have to have a physician ordering this type of test for you. But because we want the access to this test to be as easy as possible, and we want everyone, anyone that wants a test to be able to get a test, we take the burden of the physician ordering off of the user. We partner directly with physicians, and we do that on the back end. So you don't have to go to your doctor. You don't have to beg your doctor. You don't have to explain the value of this to your doctor for you to get this test. And that's because of our business model. We take that burden off of the user. So if a health coach is listening, or if anyone is listening that has clients and they want to advise this type of test to their clients, they certainly can do that. And they don't have to worry about ordering the test or being able to order the test themselves or making the client go to their physician to order this. We take care of that. So refer away. Send us anybody that you think would be interested in this type of test. And we also have partnerships with health coaches as well that might even be beneficial for the health coaches business as well. We can talk about that later, but we're always open to partnerships like that, referral partnerships.
That's great. Okay, so another question. When a health coach or a doctor or a nurse or whoever sends somebody to you, they also don't have to worry about interpreting them because
Exactly.
your people interpret it.
That's right. Actually, that's one of the biggest reasons why doctors are usually hesitant to order this type of test. The interpretation piece, that's a difficult thing.
Mhm.
You receive a report essentially, and sometimes that report is complicated and it's not very clear. And as a doctor, you might not understand what this particular mutation might mean for the patient's health. So doctors are very hesitant to order this test because they don't have the experience to understand what the report means. We also take that burden off of the physicians or even off of the health coaches that might be referring people to us, because again, we partner directly with genetic counselors who are experts at understanding these reports and understanding what these mutations mean for patients. And they essentially explain it to the patient, they simplify it to the patient, and they may guide the patient on some really great next steps for themselves on how to reduce the risk that might be found in their report. So you're absolutely right. There is no interpretation responsibility for any health coach that refers this to us. We do handle that with our genetic counseling partnerships.
Okay, and so if our customer or patient were to order that from you, could they ask that the coach or doctor or nurse or whoever gets a copy of it with the
Sure.
interpretation?
Yeah, absolutely. The patient will receive the report themselves, and the patient will receive a summary from the genetic counselor as well about the consult visit and the report. That can very easily be shared with the physician. The patient can share it with their physician. We are actually working on a very easy sharing methodology in the future so that the patient can very simply request, hey, please share this with my health coach or my physician or whoever, and we will handle that for them. That's not live yet. That's not something we do today, but it will be in the future. But today, a patient can very simply just share their report and their summary with their health coach or doctor.
Okay. And in the summary, did they summarize the things that the interpreter finds concerning or outstanding? And do they
Sure.
make recommendations based
Yep.
on that?
Yeah. So the genetic counselor is not a physician. They are just experts on genetics and they understand how genetics can sometimes, increase a risk for a disease or cause a disease. And so the guidance that the genetic counselors will give is here's what I'm going to tell you, but please relay this to your physician so that you and your physician can come up with a healthcare plan for you so that you can minimize your risk, right? But the genetic counselors will consult and say, based on our knowledge, this particular mutation has a higher risk of causing blah, 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 blah. And these are some medical interventions that we are aware of that can reduce your risk. That is all certainly explained and summarized. But again, the patient's responsibility is to understand this information that is relayed by the counselor and then take that to their physician so
Right.
that their physician can be aware on what some of the next steps could be for them. It's also worth mentioning, Kathy, that there's a good amount of people who receive a report that is completely blank, which is a dream scenario. We would all love to not have any identified genetic mutations that might
Right.
make us at risk, right? And some people can be a little confused by that, right? Some people might say, well, what does that mean? Is there something wrong with me that I don't have any genetic risks? And the answer is no. The answer
Have
is
a party.
have a party, celebrate, right? Of course, it doesn't mean that you'll never develop a problem or that you'll never have any complications. I mean, hopefully you don't, but it doesn't mean that. It simply means that you as an individual do not have an increased risk of developing these problems because your genetics don't seem to be carrying any of these risks. It's a great thing, but some people are confused by it. And the counselor will explain what these results mean and what they don't mean as well. So it's worth having a session with the counselor, even if you have completely awesome blank results. And that's why it's so valuable that Panacea includes that with the genetic counseling, because sometimes it's confusing. Well, what does this mean for me that I don't have any genetic risks? And that's clarified with the counselors as well.
Okay, so if your report came back with something like brain tumors, pretty
You know what's a good example?
out there.
My personal report.
Okay.
So I actually have zero family history of ovarian cancer. I would never have qualified for genetic testing through my doctor or through my insurance. And I never even thought about it or worried about it for myself, right? Because family history is a big red flag and I just don't have that. So it wasn't a concern for me. And it wasn't until I launched Panacea that I became the guinea pig number one. I was patient number one at Panacea. And of course, I dragged my poor older sister into this as well. She was guinea pig number two. And she obliged gladly because, of course, she's a great big sister. We found out that through whole exome sequencing, we both carry a mutation in a particular gene that increases our risk for ovarian cancer about 9 times the average. Now, this is really, really fascinating information, not because I'm the founder of a company who wants to deliver this type of information to people to save more lives, but it's fascinating because I never thought that I would be a candidate for genetic testing. It just wasn't something that, it was never brought to my attention. My doctors never talked about it to me, obviously. And even as an educated consumer, right? I understand genetics. I know family history is not the only, red flag for an individual to have a genetic change that could increase their risk for disease. But it just never occurred to me that I could be one of those people. And so I thought it was such a magical lesson for me to learn that this type of testing could save so many lives and could help so many people that don't even know that this is a testing that could be good for them, that they could be candidates for this type of testing. And the good news is this information has allowed me to go to my doctors, sit down with them, talk about what my real risks are, talk about what kind of medical interventions I could utilize to catch this problem early, to catch ovarian cancer early, or in some cases, eliminate it completely. In serious cases, there are some surgical interventions that people can employ. We've all heard of mastectomies. We've heard of Angelina Jolie and her BRCA mutation that essentially forced her to decide to remove her breasts. Her mother passed away of breast cancer. And so there's so many options and there's so many opportunities that an individual can essentially take by knowing this information to really reduce their risk for ever getting sick. And not all interventions are surgical. There are simple things like more screenings, some extra blood work, sometimes even medication can help reduce your risk, really just depending on what's identified in your genes. And so for me, I do extra screenings every year. I've started screenings earlier because of my risk. I wouldn't necessarily be getting mammograms or ultrasounds at this age, right? But because I'm higher risk, now I'm starting these interventions earlier so that I could catch this problem before it ever starts. And so Panacea has empowered me as a human being. Forget about being the founder of this company. Panacea has empowered me as a human being to get in control of my health and not let my genes determine my destiny. I'm determining my destiny. And so it's an incredible lesson to learn. And it's a very good example of how powerful this type of testing is. Even if you don't think this will work for you or you need it, you will be surprised. Just as studies show, 50% of people who have genetic mutations have no family history of diseases. So it's really, really fascinating and revolutionary, I think.
Yeah. You talked about all of the things that you could do with a doctor to prevent those things. And
Mhm,
health coaches are dealing mostly with lifestyle changes.
mhm.
Is there anything in the summary that provides lifestyle changes that might help to
Yeah.
avoid,
So
avoid a problem?
Yeah, so this is a really good question for a genetic counselor because they are much more well versed in this area than I am. But sure, there can certainly be some lifestyle changes that could help, even if you have a genetic mutation for some of these things. Obviously, if you have an increased risk of, let's say, colon cancer, the best thing to do for that is get increased more frequent colonoscopies, start the colonoscopies earlier. But some advice might be changing up your diet. High fiber diets obviously reduce the risk for colon cancer, even for people who do not have genetic mutations. But it could be something that if you do have a genetic mutation for, and you're not a big fan of, green vegetables and fiber, that you really strongly consider adding those into your diet because that might help reduce your risk as well. Clearly, that's not the only thing that needs to be done, but it could be something that a health coach could really guide on. Exercise obviously is great for all of us, not just individuals with genetic mutations, but even more so for somebody in a high risk category. They should really be encouraged to do these types of things because studies left and right show that these things could help us reduce our risks. And somebody with a genetic risk may never develop a problem, right? It is a risk assessment, right? So it kind of helps us understand where we stand. But once we understand where our risks are, we could really, hone in on those areas in a very targeted way to help reduce our risks, obviously. But yeah, there definitely could be some lifestyle changes that, in conjunction with some medical interventions, could really help people.
You said that your sister and you had those done.
Mhm.
Would it work to have one member of the family have it done and then spread it around through the family and have it
Absolutely.
apply to everybody,
Yeah.
or does everybody in the family need to do it?
Oh, good question. So it might be a good idea to start with one individual. You don't have to start by testing absolutely everybody that's a first degree relative to you, right? You could start by just testing yourself And then if you have a risk, then that might be a good sign for your sibling to get tested, or perhaps your mother or your father to get tested, or your child if you have an adult child. So you don't have to just blanket test everybody. You could start with one person, but keep in mind that unless you are an identical twin, even your first degree relatives are going to have changes and mutations that you don't, and vice versa, right? My sister and I just happen to inherit that faulty version of that gene together, right? But it could be that I have a mutation that my sister doesn't, or my sister has a mutation that I don't. And so if my sister doesn't get a test and I don't have a mutation, and she's relying on my test results to decide if she wants to get a test, she might miss something herself because we don't have the identical exact genes. So if people want to start off with one person, not a bad idea, but keep in mind, people's genetics aren't identical, even if they are your first degree relatives. So it's not a horrible idea for everyone to consider doing this for themselves.
Sometimes I think, why would we want to know?
Yeah.
How do you address that?
You know what, Kathy? That is probably the number one question I get, or number two question I get. The first question is, how is this different than 23andMe?
Yeah.
But the next question is, do I really want to know? Right? I'm really afraid. And I think it's a very, very valid feeling. I think fear of what could be hidden is something that might stop a lot of people from actually wanting to know. Here's what I always say though: your genes are not your destiny. And that is nowhere more true than in genetic testing. Because if you can uncover where your genes might be carrying some danger for you, then you can outsmart them. You can get ahead of it. You can be in control. And of course, this is not for every single gene, not for every single case. There are some genes that might be revealed that don't have a ton of interventions and might not necessarily be totally actionable. But there's a very good amount of genes that we know what to do about, right? And so my follow-up question to you is, okay, you might not want to know, but if you know, and then you can change the outcome, or you can have a very good chance of changing your outcome, why wouldn't you want to know? This is, again, all about empowerment. This test would be nonsense. It would be useless if I handed you a piece of paper and said, sorry about your crappy luck. Good luck, right? You can't do anything about it.
Just wait it out for 5 years.
Yeah, just wait it out. Go to your doctor and keep your fingers crossed, right? This would be useless, absolutely useless. The power of this test is in its ability to kind of give you an idea of what your future could look like and how you can change it, right? That's the power of this. It is actionable, it is empowering, and it allows you to be in control rather than sitting and waiting for your genes to decide what they want to do with your health, right?
So is this test the end all and be all of preventative testing?
I wish I could say yes to that. I really do. I think nothing would behoove me more than to tell you this is it. This is the holy grail of testing, but it's simply not true. Preventative genetic testing is a incredible tool that you should add to a much larger tool shed of things that you should consider in order to really stay healthy and prevent disease. Obviously, these are things that you can certainly discuss with your doctor or maybe with your health coach. There's a lot of things that you can consider adding as tools in your tool shed. Genetic testing is one of them. Also, a lot of people opt to do GRAIL testing, which I think we've talked about before, Kathy, but I'll summarize quickly. GRAIL testing essentially identifies an active cancer in the blood that might be still so small and it might be missed by screening methods like MRIs or CT scans, et cetera. And so that is an incredible test that is available today. It's offered by a company called, the company is actually GRAIL. And the test itself is called, oh my gosh, it's slipping my mind, the Grail test, Gallery. The Gallery test by Grail. And that's direct to consumer. You can order that. I think it's $900, and they advise that you do it every year. And it could essentially catch a cancer before even a screening test or even a blood test will catch a cancer. So that's another very powerful tool that could be added to your tool shed, along with inherited disease genetic testing, which is what we do. There's preventative MRIs. There's a company called Prenuvo that is offering MRIs to the public. You don't even need a physician to prescribe this MRI for you. They, very similar to Panacea, have their own physicians that could order a test for you. And no insurance company is going to order you a preventative MRI. No doctor is going to order you a preventative MRI. And that's why these companies are so incredible, because they're bringing this tool to you that could be used as a preventative method, as opposed to a diagnostic method or something that's used when you're already sick. And again, it's a direct to consumer offering. The choice is yours, whether you want to do it or not. So there's so many incredible medical technologies that are now being offered directly to consumers, because consumers need to be in control of these decisions.
Why are people doing colonoscopies if they can find that stuff in a test?
So that's it. So to be honest with you, colonoscopies are still the best method to identify a cancer or an early stage cancer. They are still better than the at-home Cologuard tests, or some other companies, of course, are doing those stool sample tests. The stool sample tests are a great start, but they are not as effective in identifying a cancer as a colonoscopy. So again, this is why there's more than one tool, right? Because tools together in conjunction are so much more powerful than the tools independently. And that's another great tool, right? The Cologuard, the at-home stool sample, gives you a great idea of, where some issues might be brewing. And then maybe a colonoscopy could be used as a follow-up to that. But it is not a replacement of a colonoscopy. It should be done in conjunction with a colonoscopy. So lots of great tools, and these are all tools that should be used together to put you in the best position for preventative healthcare.
I've heard a lot about data breaches. How is the information kept safe?
Yeah. So also a very valid question. And I think data privacy prevents a lot of people from getting genetic testing as well. So the courts in the United States, this is so insane, but it's true. The courts in the United States have deemed any DNA that leaves your body, essentially, especially in a healthcare setting, as not yours anymore. So if your doctor removes a tissue sample for a biopsy, or even if you get blood work done at a lab, technically those entities have every right to use your data, your genetic data, for research or for quality purposes or for whatever, as long as they de-identify it, which is a requirement of HIPAA, I believe, and probably multiple other laws. So your de-identified data, in theory, can't be linked back to you, but your actual data can be used legally by any of these entities to better or further science or medicine. So that's perfectly legal in this country. Here's where some people, might be interested in learning more about. The company itself could have their own policy that says, we don't care what the courts allow us to do. We ourselves do not feel comfortable sharing the data without the user's knowledge and control and transparency. And Panacea is one of those companies. We do not use your data unless you allow us to, unless you're aware of exactly how we're using it, and you're perfectly okay with us using it, de-identified, of course. So we put that decision in the hands of the user, not in our hands, because we want to take a further step into respecting the privacy wishes of the individual. There are a lot of people who don't care, who say, I don't use my data. Who cares? It's not going to be linked back to me. Even if it is, it's not that big of a deal. And some people feel very strongly about their data being perfectly hidden and protected. Now, data breaches and hacking is a common thing. Unfortunately, there's no fail-safe way to fully protect somebody's data. And so obviously we want to be transparent about that. We do our best, and many companies do their best to keep that information safe. But when it comes to raw data, your raw genetic data, without any other context, without your information, your name, your address, or your other health problems, or any other context, that data, believe it or not, is quite useless. Even if your raw genetic data happens to, find itself somewhere else outside of a genetic company's database, it's kind of useless. It can't even be sold for money. Like, no pharmaceutical company, no research company is just going to buy a bunch of raw data. It's really worthless. I'm not sure if that helps quell some people's fears, because nothing can really be done with that data. But the bottom line is the policies, the data policies of the companies that you're sharing your data with are really what is important when it comes to data sharing and data privacy. And that's something you should ask before you send your data there.
Are there any risks in getting the test done?
So when you talk about any type of medical testing, you have to ask about the risks, right? There's really three types of risks. There's the technical risk, like how good is this technology about delivering real, factual, data? What is the error rate of the tech? And then there is essentially a psychological risk, right? Like, is there is there some psychological harm that could come from this patient doing this type of test? And then there's a physical risk, like a harm. Is this type of test going to put the patient in physical harm? Could it cause an infection, right? Biopsies sometimes have a risk because they can cause infections, they can puncture other organs. So the physical risk, the technical risk, and the psychological risk are three risks you really have to talk about. The technical risk of genetic testing is, especially when next gen sequencing is used and real high tech machines like Illumina machines are used, is so low. The error rate is insanely small. The errors exist, technical errors exist, but there's so many redundancies that are put into place, and the data is reviewed over and over and over, that the error rates are so small, they're almost not even worth mentioning. So by the time the information comes off of the machines and are interpreted by experts, the likelihood that there's an error in that genetic sequence or in the information is minuscule. So technical error rate, very, very small. So you don't have to worry necessarily about that. The physical harm to the patient, almost non-existent. This is a mouth swab that you do at home, right? Short of you poking your eye out with the mouth swab, there's no risk to you, right? There's no blood work, there's no needles, there's no skin puncturing. It's a completely non-invasive sampling method. So physical harm, non-existent. The most important harm, so to speak, or risk is a psychological risk, because as we talked about before, there's a fear in learning what this information can hold. And so not every person can handle that stress. And not every person feels empowered, even with this information, that something can be done about. And so I think the most important thing is for you to decide, is this information going to empower me and put me in a more powerful, stronger position as a human being? Or am I going to be completely overwhelmed and destroyed by this type of information? So that is the question that everybody should ask themselves. And if you feel like this information is just going to drive you crazy and it's not going to help you, you're not going to be able to talk to your doctor about things that you can do to reduce your risks without just going mad and feeling sad and overwhelmed, don't do this. This might not be the test for you. But if you feel like this could empower you and put you in a much stronger position and give you information that you would never otherwise have, then do it. This is a test for you. So really, that's the biggest risk, I think, is the psychological risk.
Say that you're somebody, or you have a customer or patient that is always thinking there's something wrong with them. Would a test like this help them, or would it hurt them?
I think it would be a case by case. I think as a health coach or as a clinical provider, you sort of have to really have this conversation with the individual themselves. if you really feel like this particular patient is going to just not do well with this information and it's going to cause a bad domino effect for them, even if they can get ahead of these risks, but they're just going to be in a bad mindset, then those are probably not the patients you should refer. But again, if your patient, maybe a little bit of a hypochondriac, but takes action and has shown you that they're able to kind of manage this type of stuff and they do feel empowered and they want to have all the information, then do it. Then refer them or recommend this test for them. But it really is going to be a case by case basis. I don't want to generalize and put everybody that might feel one way into a bucket. It has to be an honest, open conversation with each individual.
Okay, so if we've taken a lot of time now, I think we've
No
gone a
worries.
little bit over what I
That's
said we
okay.
were going to be. But
Don't worry.
if somebody wants to get a hold of you and add this to their business, if they want to be able to use this with their customers, how would they reach you?
Yeah, so you can just go to our website, seekpanacea.com. There is a contact form. Fill out your information. Tell us a little bit about yourself and what you're interested in doing with us, and our team will review it. And of course, somebody will reach back out to you, and we can certainly discuss a formal partnership or a referral partnership, something like that. But you could always reach us at seekpanacea.com in the contact form, or you can also email us at contact@seekpanacea.com. That's seek as in search. So SEEK, Panacea, PANACEA.com.
Right. We'll put that information below the podcast. So
Excellent.
they can just click on it and get through. Okay. Well, is there anything that I did not ask you?
I think you did a great job of asking really good questions and covered a lot of stuff. Obviously, if anybody has any questions, they could also reach us as well and ask anything specific.
That's great. Thank you so much for being on here today.
Thank you, Kathy. You take care.
Thanks for listening to the show. If you liked what you heard, please give us a 5-star rating or review on iTunes.